A warm welcome to everybody from the Medicorium, the Center for Dermatology and Aesthetics in the northern part of Frankfurt, located in Oberursel. My name is Dr. Daniela Kreiner-Grüger and I'm a board-certified dermatologist. I'm in private practice since 2001. Prior to that, I was trained in the Department of Dermatology at the Frankfurt University Clinic. And I had the pleasure to stay for 2 years in the US. This was a scholarship which I attained, and I had the pleasure to stay for 2 years at the Duke University in North Carolina, in Durham, North Carolina, which was a really great experience. So looking at that back, I've got an experience of over 30 years in dermatology, and this is really something I would like to give back to you. So in 2013, I had the great opportunity to found the Medicorium in these rooms, the rooms which I like to show you today. The rooms are really modern equipped, and we have a great setting of energy-based devices and the newest and latest laser technology. But what would all this be without the staff behind it? So I have a great medical staff and a great doctors behind me, which gives me the opportunity with an intercollegial exchange. So we have the possibility to discuss cases, so pretty equivalent on a university level. We also try to do training on the medical side for the doctors and also for the medical staff on a very high quality. So overall, we try to deliver classical dermatology and aesthetic competence with the most up-to-date medical know-how. We also have a motto in our clinic which says, it is important to feel good in your skin at any time, because your skin is surrounding you every day and every minute. So we really have the effort to combine the dermatological know-how and our aesthetic competence for your good. But let's see it live, what I have to offer you in the Medicorium. Due to the corona pandemic, we had to look for new ways to get communication with our patients and clientele. So this is a new way to go. This is a virtual, like a virtual tour through the Medicorium. And we are starting here, right in front of the reception. So imagine you have a kind of treatment wish or treatment desire. This is where you first come to. That's our reception area. And just next to it is our waiting room. But now I really would love to show you all our treatment rooms. But most of all, I would love to show you my staff and all the people I work with. So come with me and I take you around. So now I would like to welcome you in our treatment room number 2. This is our cosmetic area. And just right next to me is our chief consultant beautician, Ms. Jeselgers. I'm really happy to have her on my side because she shows a lot of empathy in treating patients and she has a great know-how about the skin. She's a really all-round beautician. So she covers all different treatments options of the skin, superficial skin, to improve skin quality. We offer superficial, mid-deep and deep skin quality treatments, and the selection, the choice of the right treatment is depending on your skin problem and on the state of your skin. So for example, in the superficial range of treatments, we offer peeling, we offer the microdermabrasion, and we also offer hydrofacial. In the mid-deep, mid-dermal area, we offer treatments like dermaneedling. This also can be combined with the so-called platelet-rich plasma treatment, which is a certain treatment where you take blood, then you centrifuge the blood, and then you take the platelet-rich plasma, which you then can apply to the skin. But you know, Ms. Jeselgers stands right next to me. Let's ask her what her favorite treatment is.
Hello, my name is Songül Yesigers. I joined the Medicorium team 3 years ago. And until now, it has been a great experience and learning curve for me, as we are already up to date with our treatment regimen. Dr. Kreiner's main interest is to achieve natural beauty. I am aware that we don't have enough time to cover all our different treatment modalities. That's why I want to demonstrate my favorite treatment, the hydrofacial, to you. For me, the hydrofacial is the perfect treatment option for an in-depth cleansing of the face. You can use it for mild acne and large pores, hyperpigmentation, or for skin tightening in every skin type and in female and male patients. What do we want to achieve? We want to achieve a glow with an even skin surface appearance, and we want to supply the skin with active substances. But now I will show you the treatment. My patient has already been cleaned and prepared for the procedure, and let's start. In the first step, I'm using a microdermabrasion device for superficial removal of dry epidermal cells. In the next step, I am applying a soft alpha hydroxy acid peeling and massage it into the skin. This is important to prepare the skin for the in-depth cleaning. Occlusions of the pores are softened. These two steps are a preparation of the most important third part of the treatment. This is the in-depth cleansing. Now we are starting with the in-depth cleansing of plugged pores by a vacuum applicator. Sebum occlusions, skin impurities, blemishes, and plugged pores are opened. In the fourth step, a mixture of hyaluronic acid and antioxidative substances and vitamins is massaged into the skin. The skin was purely cleaned and abraded in order to let the active substances penetrate into the upper skin. This step is repeated until the skin is nicely dry and all active substances have infiltrated the upper layers of the skin. The last step consists of using a red light for skin soothing and collagen stimulation, or we can also use a blue light for healing of skin blemishes and inflammations. The red light is applied for 2 minutes to the individual areas of the face, covering step by step the whole face from the top to the bottom. Okay, that was what I really wanted to show you. There's just one small tip from my side. The hydrofacial should be done 3 to 6 times for achieving an attractive, glowing skin appearance. So, this is our treatment room number 4. And here we have a special knowledge in this room about unwanted fat pads and removal of these. So, you know, everybody of us has experienced, you can lose as much weight as you want and you can do as much sport as you want, but there are still some very resistant fat pads
And they are sometimes really annoying, like like the love handles, or if it's in your belly area, or is it the double chin. They are really different areas of the body which can be of concern. So there are several devices in this room which can help for that. One is the cool sculpting, which is here on my right-hand side. It's called cryolipolysis. So what do you do with those machines? You suck in the area and then you cool it down for +4 degrees Celsius. And after the treatment, in a time frame of about 6 weeks, 6 to 8 weeks, we have the fat is melting. We're inducing an apoptosis. This is also a really good device to do body contouring on the thighs, even on the inner thighs or on the outer thighs. Yeah, so we really prefer this treatment. But there's something else, and that's called the sculpture laser. So we can also treat annoying fat pads with heat. So what this machine is doing, it's heating up the skin 12 degrees. So if you have a regular body temperature of 36, it's heating up your temperature to like 48 degrees, and it's keeping that temperature for about 25 minutes. And you also get a fat reduction after 6 to 8 weeks. But in addition to that, this sculpture laser is also inducing some skin tightening, which is of help if you treat like the arms, the upper arms. Yeah, that's an area where we have loose and a loss of skin elasticity. We complete our whole spectrum of body contouring devices with a radiofrequency device on my left-hand side. It's called Viora. And this device, the radiofrequency is running from one pole to the other one. And the skin is sucked in, and with regular circulatory movements, you go over the treatment area, and you induce also a slight heating up of the area and a good collagen stimulation. The secret of success is to combine these treatments. We are just not, we want to contour the whole body, we want to melt the fat pads, and we also want to tighten the skin. That's what we want to achieve with these different kind of methods. As this is a really big issue, we are planning to give another webinar on that subject where we can give you more in-depth information about the individual treatment procedure and how it works. So let's go to the other room. So now we are here in our treatment room with the number 6, and I'm really happy to welcome my dear colleague, Dr. Stefan Kruse-Bühning, who joined the Medicorium in August 2020, and we are very happy about that. He started his dermatology training with Professor Altmaier in Bochum, and then he continued his training at the Laser Clinic in Karlsruhe and also at the University Hospital in Mainz. I really value him for his expertise in dermatology, but also he's a very acknowledged laser expert. So let's see, Stefan, what have you brought for us today?
Thanks, Daniela, for your kind words, for introducing me. We are here now in one of our intervention rooms that shows different lasers. We start here with this one. It's an ND-YAG laser that has different wavelengths to treat different colors. Every color needs a special fitting wavelength. There at the window we have a erbium YAG laser that is not especially used for tattoo removal, but can condition the skin to in case if you have some recalcitrant tattoos. And this is our power laser, the so-called PicoSure, that delivers ultra super short pulses and can treat the tattoo very effective, but with a low amount of pain. And this little helper here is not a laser, but a device that is very, very useful and important for us. It just delivers water-free cold air to the skin. That means we have less pain and we have less of the possible side effects of a laser treatment. So very, very helpful device in here. We really love here in the Medicorium, we really love our PicoSure, the picosecond laser, because it works super fast. It can remove the tattoos very fast with low side effects and low pain, what we really appreciate, and the patients of course too. Let me just, before we go more to a hands-on situation, let me just explain in some short words how it works, the tattoo removal. Imagine it like a big orange. You as a human being, you could never eat the big orange. You need to cut it into pieces to be able to eat it. And that's exactly what we're doing with the laser. We cut the tattoo particles into smaller pieces that are then like available for the cells of the immune system to eat the particles. Yeah, and I'm very happy. That's enough of the words. I'm very happy that I could have a patient today here, that we have one who I can show you the treatment, the practical treatment with the laser. I'm very happy to show you that now. Okay, now we are live here in tattoo removal, hands-on, treating a black tattoo, as we can see soon, with a PicoSure. And let's get started. Okay.
So now we've learned a lot about tattoo removal, and we can really say it's a complex area. In an area like that, you have to find the right address and the right practitioner with specific knowledge about the removal. On the long run, otherwise, problematic side effects can occur. I'm a member of the German Dermatological Laser Association, and in this association, a lot of side effects have been reported to us. So the law has changed in the last year, and now only doctors are allowed to remove tattoos. These doctors need a specific certificate stating that they are qualified and that they have expertise in laser tattoo removal. The Medicorium is optimally prepared for this situation, as we are a part of the educational certification program. But let's see what my other colleagues have prepared for you. Okay, so now we reach our surgery unit. And here's my dear colleague, Dr. Lilian Krishan. Dr. Krishan started her medical training in the Artemet Dermatological Surgery Clinic in Munich. This clinic is also specialized in phlebology and phlebology surgery. And we're very happy to have her here. And now we see what Lilian is going to show us today. So Lilian, it's your turn now.
Thank you, Daniela. I'm Dr. Lilian Krishan. I've been working here in Medicorium for about 2 years now, and I want to give you a further impression of our ambulance. So the frequency of skin cancer is increasing in the last years. On the one hand, this is because of our free time behavior and enjoying a lot of sun. On the other hand, there's an increase of intensity of the sun. What can we do? The most important thing is certainly the prevention. How do we prevent? Using sun protection with a high protection factor. This means a factor of at least 50. Otherwise, there you have the possibility to wear a hat, to wear skin covering clothes, and to avoid the sun in the afternoon. So your skin health is our passion. This is why we care about and do a skin check, a regular skin check. This is really important. So this is a dermatoscope, and dermatoscopy is like a magnifying glass. We use it to check your navy And so we can find any changes in your nevi really earlier, because you can see it bigger about 10 times. This checkup is supported by a photo finder. Photo finder takes pictures of the nevi, and you can compare them after some time. I want to give you an example. So on the left side, you see the nevus in August 2018, and on the right side you can see it about 1 year later. So you can see now that it has gotten bigger. There's activity in the central, and the color is quite darker than a year ago. What we also do here in the ambulance is ambulance surgery. You can see a modern operating unit in here, and we do the surgeries in established local anesthesia without suffering pain, of course. After your surgery, you will be introduced into wound treatment, and then you go home. A further field of interest here in the ambulance is the removal of telangiectasias or spider wings. There are different possibilities to do it, and it's depending on the indications. You can do it with a fluid or a foam sclerotherapy, or alternatively with a vascular laser. How does it work? There is a mixture of air and ethoxysclerol, that's a kind of alcohol, and you get a fluid foam. This foam is put in the vein, is injected in the vein. It goes to adhesion at the vascular wall, and afterwards it gets resorbed by your body. Afterwards, you shouldn't do sports, and you shouldn't go in the sun for 4 to 6 weeks to have a very good, to have the best results. If you're interested for something like that, just don't hesitate to ask me. Thank you.
Hello again. Well, now you've become familiar with my colleagues and with my staff. But now the big question is, what is my expertise? What am I doing? So this is my favorite room where we are in. This is the treatment room number 5, and I really love to be here and to do my treatments. So looking back at my background, I have a real strong scientific background in clinical research. My interest was always to offer conventional-based medicine, you can also call that school medicine, at the level of the most up-to-date medical know-how. During my time at the Duke University, I participated in evidence-based clinical trials research, and so I continued to do research in the field of aesthetic medicine, and I'm still publishing in international journals. Since starting my private practice here in Oberursel, I developed a strong interest in cosmetic and aesthetic dermatology. For me, is the treatment and the combination of pigmentary disorders, of skin redness, of skin irritations, of skin blemishes, and the prevention of skin aging. That's all one combination, and that all belongs together. And you can also only be strong if you consider all these different factors. I'm known in Germany as an expert in skin rejuvenation with botulinum toxin and with hyaluronic fillers. I'm a member and faculty of a leading pharmacological company in this area. You probably are familiar with Allergan. In addition, I'm a speaker on national and international conferences, and I'm active in educating and training younger doctors. So the Medicorium has the following guiding principles. First of all, we want the best for our patients. And we want to achieve that in the form of working hand in hand together. We've got a commitment to continuous learning and growing with our challenges. We are working for constant improvement. And the overall is that we are proud of our achievements. So now I'm really happy to open our chat, and I can't tell you how much I wait for all your answer, for all your questions, and what are you interested in. And it was a great time to be with you. And I say bye-bye to everyone, and I really hope to see you back or see you at any of the other webinars. Bye-bye.